man came to Ewekoro, which happens to be one of the local governments in my federal constituency, Mr. Speaker. But my worry here, Mr. Speaker, is that I'm so sad in this country. From time immemorial, we have been talking about risk factors, such that somebody arrived to this country from Lagos to Ewekoro cement factory, where the man went. It's 54 kilometers from Lagos.
Hand over that, leader.
I'm from Delta State. Mr. Speaker, I come under privileges. Order 6, Rule 2. Mr. Speaker, if you recall, it was all over everywhere in the news that what has recorded in Nigeria today that will have coronavirus is from Ogun State. Not only from Ogun State, it is from an Italian man who visited Ogun State, and it turned out to be the constituency of Isiaka that is speaking. Mr. Speaker, I'm coming to something, Mr. Speaker. It's very worrisome, and I think, Mr. Speaker, in good wisdom, that this House should suspend plenary for a period of 2 weeks or thereabouts for the purpose of certifying everybody and also allowing management to put measures in place so that all of us can be tested, because we may be taking it as a very joking matter, but it's a very serious matter. And I think that this House should take it as a very serious matter. Otherwise, you will not know who you will be shaking. To add up to that, sir, the driver, the man that was with the Italian, has gone into oblivion. He cannot be seen. It's possible that he's hiding in Siaka's house. But I don't want to preempt that. But honestly, joke apart, I think that the management and National Assembly should take measures to ensure that this matter is taking the seriousness that it deserves. I so submit.
Opportunity. Mr. Speaker and my colleagues, we are now faced with our worst fears. Here in Chambers, we shut down a motion to bring back our brothers and sisters in Wuhan. Why did we bring down that motion? For fear of not having it in the country. Let it not come because we are not prepared. Finally, our fears have caught up with us. We saw where ministers were priding themselves that Nigeria was ready. Nigeria was ready for the coronavirus. Probably that was the invitation that was given to the virus to come. And what was it that made them ready? They were wearing face masks that were not certified. As far as I'm concerned, I don't know how effective those face masks were. And who were the ministers? Ministers who may have nothing, absolutely nothing to do with the prevention of coronavirus. Probably because certain amount may have been budgeted. I don't want to go into that. Even when a minister in charge was addressing the world, the kind of seat, Mr. Speaker, that he was seated on shows the world how ready, indeed, how ready Nigeria is. It simply means that we're not prepared for anything. Therefore, there is urgent need for all hands to be on deck. The period of incubation for this virus has even been extended beyond 14 days. So if we talk about somebody passing through a system that is set up, probably a computerized thermometer, if he is a carrier, probably 2-3 days old, he can walk around in entire Nigeria without showing symptoms. The incubation period is about 20-something days now as we speak. We don't even have enough literature, we don't have enough information about this virus. It simply means that we should sit up. We should be more proactive. Here in this assembly, as you walk in, there is nothing to check any man who is symptomatic even. If somebody is symptomatic, you can walk from the gate and walk past all the security checks. get into offices, and you go back without being detected. We don't have one single thermometer anywhere around this complex. Mr. Speaker, are we ready for what is coming to us? The answer is no. I want to urge my colleagues, let us look at this country, make decisions, make contributions that will indeed better the future of this country and that of our children. Thank you, Mr. Speaker.
While I appreciate their contribution, sorry, I want to intervene a little to introduce or to give out their own contribution. But I thought you should allow Isiaka to learn. While I appreciate the concern that this is a very serious matter and we should also take it serious. Isiaka, you may proceed with that contribution.
Thank you very much, Mr. Speaker. I may have had contact with the Italian man. Maybe that's why. Sir, what I'm trying to say, sir, from time immemorial, because this concerns all of us, when we talk about risk factor, there are three basic things we should always be looking at. We look at the elimination stage, we look at mitigation stage, and eventually, which is the last point, which is the control. Unfortunately, in this country, everything has so been decimated that we only jump at the control side, and that is when everybody becomes proactive instead of being reactive. At the port of entry for this gentleman, and I want us to take this seriously, at the point of entry, right at Kedah International Airport, and this fellow had stayed for 48 hours everywhere before he eventually went to WAPO, where, of course, so I was told, he is a consultant with WAPO. And WAPO is in Ewekoro. That's the cement factory in Ewekoro. Before he eventually went there. So within 48 hours, this same gentleman, of course, I'm not trying to say any bad thing about him. That's what God, Allah, brought to him. But he now imported it to our country. But the essence of my argument now, and why I'm trying to support this motion that the whole House should overwhelmingly give it an overwhelming support, is simply because we should always look more at preventive measures. That's to be proactive, not to wait to the point of being reactive. The facilities are not here in this country. The last time the National Control of Disease came, fortunately, Mr. Speaker was there to visit the health services. We had a joint meeting. At the meeting, they were challenged about the control disease centers in this country. The gentleman told us here, which was not more than a month ago, in this country that there are only 2 control centers. One in Lagos, one in Abuja. That of Abuja, we were told, is less than 30% completion. Even the one in Lagos, the same man was challenged by a honorable member that it was not built by the Federal Republic of Nigeria, by the government of Nigeria. And that place was constructed and equipped by the Lagos state government. So apparently, Nigeria is standing at 0 as far as at the federal level, any disease control and mitigating or elimination factors are concerned. So I want to appeal that this is a wake-up call for all of us. We are just talking about coronavirus here today. We don't know, God forbid. What again after coronavirus? We are once on Ebola, we are once on this and that. Of course, we thank God that they've been able
to... Thank you. I think we should limit ourselves to the rules we have set for ourselves. Every person contributing should not...
Member representing Ukana Federal Constituency in Akwa Ibom State. Mr. Speaker, distinguished colleagues, it is no longer news that what we feared most has come over us, and that is coronavirus disease. It's here in the country. And when we first heard the news that as was announced in China, I think that was on the 20th of January, we thought as a country that we'll be able to prevent it from coming into our country. But unfortunately, it has entered the country. And there is nothing we can do than for us to rise to this challenge as the people's representative, that we have the mandate of our people to make good law that will guarantee lives and safety of our consequence. Mr. Speaker, I think, in my opinion, just like I read in the motion, there is serious need as a parliament, as the people representative, for the leadership of the National Assembly to set up a committee that comprises of the senators and members of House of Reps, a joint committee to look into this matter, to interface with the executive, to play oversight function on all health institutions, all the agencies, so that this matter can be controlled. Because if we don't do this, it's going to spread like wildfire across the entire country. And that will not be good for our economy. That will not be good for the lives of the people that we represent. So on this note, I want to appeal to my colleagues to see this matter as a very urgent one. I want them to support, I want to appeal to them to support this motion to sail through so that immediate action can be taken right here in the chamber. Mr. Speaker, distinguished colleagues, I so submit. Thank you.
Honorable Lugan.
Mr. Speaker, indeed this motion is timely, but my main concern, Mr. Speaker, am I protected, Mr. Speaker? My main concern, Mr. Speaker, is the issue of isolation centers. We currently have, Mr. Speaker, we currently have only 3 isolation centers in Nigeria. There's one in Yaba, in Lagos, one in Abuja, and the other one in Edo State. The one in Abuja, Mr. Speaker, is a 15-bed isolation center with a maximum capacity of 30 people. The one in Yaba is also 30-bed capacity isolation center. I do not know the capacity of the one in Edo. But Mr. Speaker, Nigeria is the most populated country in Africa with a population of 200 million people. And we have only 3 isolation centers that will take a total of 100 people, maximum. Mr. Speaker, it will be a tragedy. And God forbid, if anything happens, and we need to isolate 1,000 people, 5,000 people, 10,000 people, what do we do? China built a 50 to 100,000 isolation center in less than a week, Mr. Speaker. And coming back to what the minority leader said, Mr. Speaker, I am taking it seriously. It is not a laughing matter. Because, Mr. Speaker, in Iran, the vice president contacted coronavirus. 2 of the cabinet members have died as of yesterday from coronavirus. So it shows you, irrespective of status or where we are, anybody can have it. So I quite agree with the minority leader. If he says members should be screened, if he says there must be a control center or whatever within the National Assembly, I agree with him, Mr. Speaker. So, Mr. Speaker, I thank you very, very much for giving me the opportunity to talk.
Dr.
When we know that that place, they are taking care of them, they are quarantining their people, our people will maybe be better off until we get ready. And then all over the social media, oh, we are buying vehicles. We don't care about our citizens that is residing outside Nigeria. And that is to tell you the way our mind functions. It is very sad. We are worried because we know that the virus does not understand language. The virus does not understand who is a member of House of Reps, neither a governor or senator or president. So members of National Assembly, we are worried as everybody who has sensible or who is responsible enough to know that this sickness can kill. So having said this, Mr. Speaker, I am saying that we are worried and we are supporting this motion to say, yes, the situation is here now, but how do we manage it? Somebody has come into Nigeria, the person has this virus, the person is quarantined, is under investigation. And I've seen the Lagos governor trying to walk around the clock to try to do something. I've seen also Minister of Health, even though people are talking about seat. What is problem with seat? Is the seat the problem now or what the message is passing? For me, it doesn't matter. It's under that condition, will he be going to look for a conducive seat that is executive for him to address Nigeria? So that one shouldn't even come on the floor of this house. The message is simple. We are worried and something drastic has to be done. Mr. Speaker, with your kind permission, let me just round up. Last week, the Senate moved a motion concerning this, and they talked about the way the handlers are handling these things at the airport, that we are not just serious. That where he traveled to South Africa, they had to come inside that plane and then check people before they disembark. Why don't we do it? And you see people just tell, okay, come, have I checked you? Okay, 21, 22. No, we should be more serious than that, because the virus is serious as any deadly. This is very lethal. So, Mr. Speaker, I am calling on the people that are working at the airport to be serious and let them do something proactive. Don't wait until people disembark. You can enter that plane, check people properly so that you'll be able to take people from there, because you are talking about some people are saying, well, somebody, what they had, of course I heard from Minister of Health that some of the people that we are contacting, either they don't have their phone number or they gave numbers that you are not reachable. So that's the situation. So this is the kind of things that we take into consideration. So we go there and nip it at the bud. Don't wait until people enter into our street, enter into our market, enter into National Assembly before you start to fish them out. We should go to the port of entry and start. And of course, the contact, the index cases, they should also trace them and make sure that people are quarantined. And of course, because the time now is about 21 days, that means the disease is serious and it should be taken seriously. I support the mover of this motion, and I believe that every honorable member will support it.
I'm Honorable Dr. Yusuf Tanko Sununu, member representing Ingaski Shanghai Awuri Federal Constituency. Mr. Speaker, I'm from Kebbi State. Mr. Speaker, let me start by commending and thanking the entire members for the interest so far shown on the incidents and happenings surrounding coronavirus in the country. As we are all aware, we have an index case that is currently undergoing management. Mr. Speaker, I share the concern expressed entirely by the members. However, I want to also say that since the diagnosis of a coronavirus infection in the country, the Nigeria Center of Disease Control has done so much as in doing much to ensure that this country is safe. I quite agree that the isolation centers are so far very few. We need more. And I also quite agree that people need to understand between the differences between isolation and quarantine. People can be quarantined based on the fact that from the history of where they are coming, they can be kept in a particular place to monitor the signs, symptoms of a particular disease, especially infectious disease over time. When the incubation period is over and none of them develop symptoms, they will be allowed to go. We also have isolation. Isolation is usually done on a defined case, a confirmed case, so as to protect the generality of the public, to stop them from interacting with a case, to minimize the rate of infection, so that we can contain it very easily. And for the person that has tested positive, I can assure you he is under isolation and is receiving treatment. And let me also say, contact tracing of virtually those that he has come along with has been so far wonderful. And in fact, in the history of medical practice in Nigeria, there was no period we had better contact tracing than now. As at briefing this morning, almost 51 contact that had contact outside the airport with the index case have already been contacted and they are under quarantine. But the other issue that we have, which is a major problem, and I think I also want to use this opportunity to call on all of us as Nigerians to safeguard our life. In the manifest of the airlines, most of the contact numbers used could not be traced to the owners of those numbers. So this is another angle to difficulty in tracing those who are supposed to be contacted so that they can be quarantined to ensure that they are not carrying the disease and they can the virus and they cannot spread it to others. Now, on the index case also, in terms of training, I'm sure Center of Disease Control has done a lot to build the capacity of health workers in terms of the ability to diagnose, treat, and manage cases of coronavirus. And not only that, they have developed public useful information pamphlets so that each and every individual will have access to know and have a self-education on how he can take care of himself. I quite agree that the players as this thing, but I also need to say that we need to add there is need for an urgent creation of more isolation centers. I quite believe in an infectious disease that is unpredictable like coronavirus, you cannot predict the outcome or the cause of that particular disease. So the only way for us is make sure we are prepared and we are ready. And I also want to thank this House for passing a resolution that the procurement activities of Ministry of Health should be restored to it with immediate effect. Because this is the major hampering situation as far as the fight of coronavirus is concerned. Because the Ministry of Health, as it is today, cannot procure anything without recourse to the Federal Ministry of Agriculture. This has further worsened the ability of the Ministry and Center for Disease Control to get available needed materials adequately and timely. So I therefore want to thank all those that contributed and also to let us also remember our various constituencies. This is a time that we should intensify effort in educating our people. Virtually all of us from our own area, we have different WhatsApp groups, we are in different Facebook groups. Let us encourage people to take care of their personal and community hygiene. Because if we intensify on that, the possibility of the organism getting widespread may be limited. And I do hope that those stakeholders will also increase in their effort as far as the prevention and control of coronavirus is concerned in the country. Thank you.
Honorable Shetima.
Colleagues, I am Lawan Shetima Ali, representing Bursari, Gaidam Yunusari Federal Constituency. Mr. Speaker, I rise to align with the mover and subsequent contributors to this very timely motion. Mr. Speaker, honorable colleagues, this issue of coronavirus, from all indications, is getting out of hand, but Nigeria, we are very fortunate up to this moment that no new case has been reported, though there are some quarantine yet to be known. But I believe for now, we must praise Almighty Allah for the situation we are in. Notwithstanding, Mr. Speaker, there's need for government to intensify efforts towards providing enough means of enlightening, educating Nigerians, particularly the grassroots level. As been said by a doctor, we have constituencies. And there is need even to introduce the old-time sanitary inspectors, practically going around communities, informing them of the danger of this contagious disease. We have Lassa fever at home, and coronavirus has been, imported into Nigeria now. There has to be very high way of educating our people. We have to commend the effort of our government by having so many things in place, particularly the isolation, the testing, and what have you. But yet, more has to be done. Our attentions are only focused on the entrance into the nation through the airports, seaports, despite the fact that borders are being closed, but the movement of men and women across the borders should also be given attention, particularly cross-border communities, as we are having through Nigerian Republic, Chad, Cameroon, Benin, and others. So in this regard, Mr. Speaker, honorable colleagues, the government should put more effort to educate Nigerians on this deadly disease. Thank you, Mr. Speaker.
Chiroka.
As my person, as an honorable member, and not speaking for the House, I want to first and foremost, let's commend the Ministry of Health so far on the work they've done so far. If you remember, it was this same set of people within Nigeria that when Ebola came into Nigeria, that they were able to stem it and able to control Ebola. And we got commendation from countries all over the world, including the US. Secondly, we must commend the processes they've taken so far. And the third is that as a legislature, we should not abdicate our responsibility. We should not be here also to seem to criticize what is going on when we should be taking certain steps and certain functions to make sure that we protect the lives of Nigerians. And what have I said by that? We should immediately, as a House of the People, get involved in what is going on. We should invite the necessary agencies, the Ministry of Health, the agencies involved in this whole process, and they will come here and tell us what the issues are. Just as a legislature also, we should be able to make sure that we provide them with an enabling environment. If it's funding they need, who can abridge the law, because we are the lawmakers, and make sure we give them the necessary funding they require. And then they will tell us the processes that are taking so far. When we do all this, we are sure that we are part of the process and we are on top of the situation. I do not like some of the things I've heard here today. It is like us on the streets. We are not on the streets. We are the ones who have the law. We are the ones who are on top of the situation. We are the ones who should say what happens. We are like the agenda setters. I shouldn't be part of a legislation that will be pointing fingers. What I think we should be doing here is to call the Minister of Health. Let him come and stay here and tell us what they've done so far. Do they require more funds? Yes, they do. In America, some of them that are quarantined in their houses, not in any isolation center. There are certain things that must be taken. Even this one, we've taken a law that we should leave them in other countries. When they bring them back in America, they are in one center, in one city they created for them to be there. Even America is under criticism that even their function, their system are not at par with what China is doing. We do not have a $4 trillion budget like America does. Neither do we have a $5 trillion budget like China has. But whatever we have, we should be able to abridge it, give funding to the ministry, commend them for the work they've done so far. Their lives are in danger too. When we commend them, then we'll come here and tell them, outside the ministries, there is no other place that people go to in Nigeria like National Assembly. Go outside there and see lots of people. So also we'll let them know that they need to come here also and begin testing, just like they do in the ports, and they do everywhere. And then what do? We'll mandate the relevant committees in this house to immediately start carrying strict oversight functions. We will not give them a penny and will not know how they spend that money. Not that we'll give them money to buy masks or to buy whatever they need and then we don't find it anywhere. They must strictly, and if care is not taken, on a daily basis, give us an update, either through our website or through our social media handles or whatever it is. Mr. Speaker, this is my contention this morning, and I think that our colleagues should be able to, let's sit up. We are the legislature for crying out loud, and we shouldn't be sitting here to criticize other people. Thank you very much.
Engineer.
People of Mangubo Federal Constituency, Mr. Speaker, I'm from the home of peace and tourism, Plateau State. Mr. Speaker, I rise to lend my voice on this very, very important motion that is not only timely, but very, very needful at the moment. And secondly, Mr. Speaker, I want to adopt the contributions of my colleagues as if they were mine, because a lot of them are very extensive. Mr. Speaker, I think what we need as a country, like one of my colleagues has just said, is that we need to be proactive. We need to be proactive. Mr. Speaker, if you move from one state or one region of this country to the other, most especially majority of our people who move are moved by road. There is no any surveillance center along any of these routes. And that if anybody who has come in contact with an infected person is passing through this from one state to the other, there is no any provisions anywhere along this route that will dictate an infected person so that he can be quarantined immediately wherever he is to protect other people from being infected. There is nothing like that. Mr. Speaker, we also need to know exactly what the Ministry of Health is doing. But Mr. Speaker, before then, the Ministry of Health need to coordinate the 36 states of this country and the FCT and the 774 local governments together so that we can all be on the same page. Otherwise, we are working only in Lagos, we are working only in Abuja, and majority of Nigeria is exposed to infection. Mr. Speaker, based on this, I want to move an amendment to the submissions of my colleague to say that this parliament do urge the federal government to convene an emergency National Council on Health where all stakeholders are involved so that they will acquaint the health workers with measures that have already been put in place and those to be put in place across the country, across the 36 states and the 774 local governments to curtail further spread of this disease to any part of this country. And I think, Mr. Speaker, it is only when such a council has been held that the minister can appear before this council to brief, can appear before this very honorable house to brief us on what they have agreed to put in place as a country that will help us. Mr. Speaker, I must also commend the Plateau State government for the proactive measure they have carried out in trying to stop any infection from coming into Plateau State. When they knew that there were people who came into the state from somewhere where they do not know their destination and they knew where they headed to, they made sure that they brought those people together. And anybody that has come in contact with these people, and they took them into a safe place and ensured that they went through tests until they certified that they were okay. Mr. Speaker, they didn't stop that at just being okay. They are still under surveillance even as we speak. Mr. Speaker, if we have this across the country, we are going to go a long way in solving this matter like we solved the Ebola crisis when it came to this country. I thank you very much, Mr. Speaker, for the opportunity I saw from me. Thank you.
Yes. Speaker Yumi.
Mr. Speaker, sir, honorable colleagues, my name is Tijani Zamia Zakaria. I represent the entire people of Guru, Lassa Pipa. But doctors among us here knew that Lassa Pipa is more deadlier. When dealing with this one, I want to urge my colleagues to bring the issue of Lassa Pipa because these two diseases are deadly. So I really appreciate my chairman House Committee on Health who have said it all. And immediately, I'm sure after today's sitting, we have a meeting with the Center of Disease Control. And from there, we will ask all the necessary questions and do everything we could within our limit to see that we tackle this menace. And issue brought by the minority
motion. I also want to thank the chairman of Health Care Services for that briefing. I'm aware that at 3 p.m. the committee will be meeting with the relevant agencies, all in the view to look at what
input we can make as the people's members of legislature to lend our support to the government in this very serious, very serious matter. Mr. Speaker, on a lighter mood, I have come to, I don't know how many of us remember that line in our old national anthem that says that though tongues and tribes may differ, in brotherhood we stand. Mr. Speaker, I've come to understand that there are three very important issues that unite us much more than anything else in this country. One is security concerns. Once issues of insecurity comes up in any part of this country, you will find that everybody, irrespective of your tribe, religion, or language, comes to speak one language. What do we do to ensure the safety of our lives? Mr. Speaker, the second factor, the second issue is football. I have come to understand that once a national team is playing, representing us in any tournament, all of us from across the length and breadth of the country will come together and pray to the same God, one God, that we may win. The third one is health emergency, like this one. Unfortunately, it doesn't know whether you're a big man, whether you are a poor man. It doesn't see whether you are from the northeast, northwest, north central, southeast, southwest, or south-south. So I want to thank us for finding this issue as a point of unity to speak with one language and call on the Federal Ministry of Health to ensure that everything is done humanly possible. I was listening to Chidoka. Chidoka's concern and worry is that even we here in National Assembly, we are not safe. Nobody is safe anywhere. So I want to thank the mover of the motion. I want to thank the committee chairman. In the next 2 hours, we'll be going in for that meeting to ensure that we do all that is humanly possible to see that we are safe as a country and that our people are also safe. Thank you, Mr. Speaker.
Lastly, Honorable Deputy Whip.
Thank you, Mr. Speaker. Honorable colleagues, I am Kiru Kaulie Georgia. I represent the good people of the Sukwatu Federal Constituency. Mr. Speaker, honorable colleagues, I am from Abia State. Mr. Speaker, honorable colleagues, a lot has been said about this COVID-19 issue that we are facing now. But I want to say something here. Nigerians, we joke with everything. We have even gone ahead to bring what they call coronavirus greeting, when this is a serious matter that should be taken seriously. I'm saddened even by the fact that the motion was brought on the floor of this House, and the motion was to ask Nigerian government to evacuate